Pennywell in Sunderland. It's a place that's used to facing problems, high unemployment, antisocial behaviour. For years they've been challenges. But there is another challenge around here. If you live in this area, you are more likely to die earlier. In fact, women's life expectancy is 3 years less than the English average, and men's life expectancy 5 years less than the average across the country.
Certainly there are high levels of cardiovascular disease, that's heart disease, and respiratory disease, that's chest disease, principally from smoking, but also because of the history of heavy industrial diseases. There are also concerns around obesity, or the high levels of obesity, based on poor diet.
But despite those problems, could this area be about to see money axed from its health budget? NHS England is reviewing the way it hands out money to clinical commissioning groups. Now, at the moment, deprivation is taken into account. But one idea is to scrap that and switch money to areas with high numbers of elderly people. And that could leave a hole in the North's health service funding. Sunderland could lose £41 million, Newcastle £15 million, Gateshead £21 million, and Cumbria £62 million.
Inevitably, commissioning groups will have to look at cutting some of the provision that they give now. And that may well be some of the hospital services, or it may well be some of the community services, such as obesity clinics, smoking clinics. The potential is that we will have to reduce services in the area, and that may well have an impact on people's health and how long they live.
But they see things rather differently 70 miles away. Just over there is the North Yorkshire market town of Hawes. Now, 1 in 4 people in this area are pensioners, and their doctors have to travel long distances to get to them in this rural area. And some in the local health service think that a funding shake-up could actually benefit this community.
Well, the practice area is about 1,000 square kilometres. That's probably about the same as the area encompassed by the M25 in London. So the doctors have got a lot of ground to cover here. If they would put the emphasis on age, then it should benefit the practice enormously and help to put it on a secure financial footing.
North Yorkshire is a very popular place for people to grow old. As we live longer, people who are elderly have more complex health and social needs, and this has to be reflected in a higher healthcare budget.
There's still time for town and country to make their case. NHS England will make a final decision next month. The funding challenge, giving areas with very different health needs a fair deal.